Okay, I think this is where Ms. Baker said you all stopped, was at the sensory system in the PowerPoint for the care of the elderly patient. So I'm going to pick up here and we'll see how this goes. So sensory functioning, what senses does this affect? So hopefully, again, as usual, when I do a recording like this, I hope that you guys will take the time to look up these answers for yourself instead of just waiting for me to give you the answers, because that's how you're going to get the most information. But, of course, I can't make you do that, and I'm going to tell you what the answers are so that either way you're getting it. But anyway, so what senses does this affect? So we're talking vision, hearing, taste, smell, touch. For visual, we're talking cataracts, glaucoma, macular degeneration, and dry eyes. These are all very normal age-related sensory function changes. For hearing, we're talking about presbycusis, which we've talked about before, an age-related decrease in hearing. People often can't hear the phone unless they're in the same room with the phone. Be sure that you're not shouting with the patients, that you're not using really low tones. Speak in the ear that has the best hearing. You can slightly raise your volume of your voice, but don't yell at the patient. And speak nice and slowly. Smelling, the number of olfactory nerves decreases. Therefore, it's hard for patients to identify foods that have been spoiled and or gas leaks, things that we take for granted. Touch, we have decreased touch related to peripheral blood flow loss. Taste, our taste buds have decreased sensitivity. That's why older patients tend to eat more sweets, because they can taste sweets better than other tastes. So if they want to eat dessert first, allow them to eat dessert first. That's fine. If they don't like the foods, they won't eat enough to keep themselves nourished, and that's obviously a problem. So I've got this little cartoon here. The first old lady says, "It's windy here." The second old lady says, "No, it's Thursday." The third old lady, I said, "I'm thirsty too. Let's have a cup of tea." The first, "I need to pee too." It's kind of like the telephone game, but that's what they hear. All right, cardiovascular system. So the cardiovascular system changes with increased age. Heart muscles lose elasticity. The blood vessels narrow. Peripheral pulses are less palpable. Why do older patients complain of being cold all the time? You always see older people wrapped up and wearing extra sweaters and coats, and when you've just barely got to, wearing short sleeves and shorts and a t-shirt, and they may be wearing what you would consider to be winter clothes. And part of that is because of their decreased circulation. So they need a warmer room, and they need warmer clothes, and they need access to blankets and things like that. It's estimated that 2/3 of the people over the age of 65 have some sort of coronary artery disease. All right, respiratory system. The respiratory system, with increased age, we have increased or decreased lung elasticity. So the answer is going to be decreased lung elasticity. The alveoli don't fully expand, which leads to pneumonia, bronchitis, complications of chronic pulmonary diseases. Older adults are more susceptible to infection, especially respiratory infections related to their decreased immune system. So nursing, what the nurse needs to be sure to do is to educate on infection prevention. That's very important. For the GI system, for the elderly patient, peristalsis, does it increase or decrease in older adults? So hopefully that you know from our previous discussions that the peristalsis is going to decrease in the older adult. Decreased appetite can lead to malnutrition, weight loss, overall decrease of immune function. Constipation, the side effect of many medications, and the feces, where the feces remains in large intestines longer, therefore more water is being absorbed, which causes hard, dry stools. The decreased appetite, which leads to the malnutrition also, and the decreased peristalsis, leads to slower food digestion, poor appetite, decreased food intake. And elderly clients are also susceptible to xerostomia, which is, hopefully you already know that word for medical terminology. If you don't, take a second to pause me and look it up. But I'm going to tell you it's excessively dry mouth, which is very common with the elderly client. All right, moving on to the endocrine and genitourinary systems. Endocrine and GI, the function of the pancreas decreases, leading to poorly controlled diabetes. Slower metabolism equals weight gain. Renal, you have more trips to the bathroom related to a smaller bladder. You have nocturia, which we just discussed. You have increased risk of UTIs. The patient with kidney failure may not look ill, but they're tired, have anemia, and elevated BUN and creatinine levels. All right? They have an increased risk for UTIs related to more concentrated urine and decreased immune responses. So here's another little cartoon I found. Good drainage is key. It says they're at the bus stop and they're talking. It says good drainage is key. It says thankfully the bus came, so he never had to find out if the old guy was talking about gardening or a medical condition. All right, reproductive system. So normal decreases. The normal occurrence is to have this decrease in hormone levels. So men have a decrease in testosterone and women will have decrease in estrogen levels. Elimination of possibility of childbearing for women after menopause and decreased sperm viability in men as they age. Providing for privacy for older adults to have sexual relationships. And this is really important, and it's not something we really like to talk about frequently at all, and especially not with our elderly patients, but it is something that we do need to keep in mind and we may need to talk to our patients about. But be respectful. Just because they're older doesn't mean they don't have sex. They have no sex life, no sexual relationships. They may, and that's okay. Another thing that is common in elderly male clients is ED, or erectile dysfunction, and causes can be things like diabetes, kidney disease, chronic alcoholism, multiple sclerosis, atherosclerosis, atherosclerosis, vascular disease, neurological disease. And another thing we need to talk about for the nursing role is to discuss safe sex. And so again, while this is something we don't want to talk about often, but we need to talk about, and we only think about talking about this with teenagers and young adults, but we really need to think about this with older clients as well, because this generation, when they were young and starting having sex, they didn't have to worry about safe sex. They didn't have to worry about STIs or hepatitis or HIV. And now we do. And so you have to make sure that you're not so embarrassed that you can't talk about those things with them, but you have to be sure that you're educating them. All right, musculoskeletal and integumentary systems. Bone loss, muscle mass loss leads to a high risk for injury. We have osteoporosis, decreased muscle fibers and motor neurons lead to decreased muscle mass and strength. The skin loses the elasticity, becomes more dry and bruises more easily. Diabetics become unaware of foot ulcers and cracks in the skin. And then we have psychosocial problems of aging. Psychosocial issues. They have fears of dying, fears of loss and grief as their family and friends die. They have safety concerns of scams, and that's a huge issue right now, as we are constantly getting all these automated calls and I know my parents got one not that long ago that said, I know you really want to help your grandson who's in jail, and it just so happened that we were, I think, on vacation or something, and all the grandkids were sitting right there with my parents, but they got a call, that said, I know you want to help your grandson get out of jail, so give this much money and blah, blah, blah. Elder abuse is another issue, as well as financial concerns. Loss, grief, and dying. Refer these patients to support groups. It's very important for a number of situations, but this situation in particular, refer to support groups. Educate about the importance of good nutrition. Encourage rest. Help them find comfort and meaning. Encourage spirituality if the patient desires that. And allow the patient to grieve. Sometimes we as healthcare providers see this as just a normal thing, and it is a normal event that occurs in life, but we still need to realize that for the patients in particular, this is not a normal event, so to speak. Safety from scams and crime. Older adults are considered easy prey because they are more trusting. A lot of these scams take place over the phone. Like I was saying, when my parents got it was not an automated call, it was a person saying, help get your son out of jail or your grandchild out of jail. You need to caution them from giving personal information over the phone or the mail or the internet if they do actually even get on the internet. Or even with the mailing, they will very they tend to be trustworthy and think that everything's going to be okay. So we have to be careful about that. Other scams are things like repairmen and utility workers that these elderly patients will let into their homes or into their areas of living, and then those people will take advantage of them. Many elderly don't want to bother family members asking for help, finding trusted persons for work on the home, etc., because they still want their own independence. Elder abuse is a huge issue. So it's estimated 1 to 2 million seniors are injured, exploited, or mistreated by a caregiver. We've got neglect, psychological abuse, physical abuse. What do you look for and what do you do? So you need to look for excessive bruising in unexpected places, bruises in multiple stages of healing, bite marks, burns, lacerations, fractures and dislocations, sedation, extreme sedation, dehydration, malnutrition, excessively poor hygiene, unsuitable clothing if they're not dressed for the weather appropriately. What you need to do is to report to the proper state authorities immediately for an investigation. That is your responsibility. Okay? Financial concerns. They may express concerns about how to provide for themselves in their future when they're living on a fixed income, and I know this is a huge issue for elderly patients. You know, my parents are aging, and my dad used to worry about this all the time, constantly, so worried about his money and worried that the government was going to get his money about for whatever services or whatever. They worry about having enough money for living facilities, nursing homes, and assisted livings. They are so very, very expensive, and insurance does not cover those things. Nurses need to be empathetic and refer patients to resources such as social service agencies, social workers, your local area agency on aging, senior assisted facilities, senior citizen centers. There are resources out there that can help you find what you need, but it does take some digging. And so to have a nurse that has done some of that front work and can, then help the families and the patients be more settled and feel more at ease is huge. Positive aspects of aging. It says aging hasn't slowed me down and it hasn't shut me up. So positive aspects of aging. You have wisdom and insight. Develop social skills, successfully raised families. They've had careers. They've made mistakes and learned. A lot of information to pass along for those who will listen. The nurse needs to promote self-esteem, avoid stereotypes, and promote dignity. Dignity to help them look their best. Have their hair done, even though they're not going anywhere but to the dining room to eat dinner. Makeup if desired. You know, get them dressed, not wearing a nightgown out or whatever. All of those things are huge steps to help patients. In long-term nursing care, we need to, aging involves the loss of the ability to live alone related to health problems, physical or mental. So we look at assisted living facilities and nursing homes. And for the nurse, we need to be sure that we're looking at caring for these patients in a very different manner than from acute care settings. All right, are they called patients or residents? So in acute care setting, they're called patients or clients. In long-term care, the person actually lives there. The facility is their home, their residence. Therefore, they are called residents. And that is where most of you will be doing clinical work, in an area where the patient lives. So they are residents. Residents' needs. In acute care, you prioritize needs according to Maslow, and the care performed is done in a smaller time frame. But in long-term care, you provide ongoing life services. Oxygen, healthy elimination, rest and sleep, love and affection, self-esteem, self-confidence, enjoyment, and fulfillment of each day. Helping to meet the needs. You have the opportunity to impact the lives of residents to make their day better. You bring compassion, respect, comfort, affection, all while providing nursing care. You can also gain from the wisdom of the residents. Encourage the residents to reminisce and actually listen to what they're saying. You can actually learn a lot from them. Through these little cartoons in there. And, you know, back when I was a kid, all we needed to do to have fun was an old tin can. And that was a really, that and a really low standard for what was fun. All right, differences again in long-term care from acute care facilities. Actually, I'm going to end up having to stop this recording and start a new one to get